Hello, True Femme community. Today, as promised, we have a really special guest, and I'm really excited to talk and introduce you to my friend Leah. But before we get started, we are going to be talking about the topic of hormonal birth control today. So I just want to let you guys know that this video is going to be very informational for you, but it is for educational purposes only. And if you have follow-up questions about specific care that relates to you or questions you might have, I just encourage you to seek consult from a provider that knows you and can answer those questions for you. So today is purely for education. But guys, I'm really excited to introduce you to Leah Gagan. She's a board certified adult primary care and functional medicine nurse practitioner. She helps individuals overcome chronic illness and achieve optimal wellness by naturally balancing the body, restoring function, and alleviating pain. Through her healthcare company, Emergence Health, you should check it out if you haven't already, she blends Western and Eastern medicine practices based on patient preference, evidence-based data, and her clinical expertise. Her assessment methods are scientifically proven and rooted in understanding a person's story, very important, active listening, and detailed lab testing. Leah's practice of medicine draws on over 6 years of experience working in both acute and primary care settings throughout New York, from the NYU emergency department to a private Manhattan functional medicine practice. Her practice specifically offers in-person care in New York and Pennsylvania, and telehealth from anywhere in the United States. So I'm particularly excited about that because telehealth has made Leah accessible to many of you in many different states around the country. So that's pretty cool. Leah, thank you for being here today. What a privilege.
Thank you so much, Sarah. What a great intro.
Yeah, okay. I hope I didn't miss anything, but you're going to educate us a whole lot. So, like I said, ladies, today we're talking about hormonal birth control. And the reason I wanted to talk about this specifically is many of you are aware or have used or are currently using different types of birth control, but specifically hormonal options of birth control are something that I don't think our medical community does a great job of giving us the education we need if that's something we subscribe to. So, very important to understand all the depths of what that involves. And Leah's here to talk to us a little bit today about that. And she brings a really cool perspective. I know a lot of awesome medical providers, and maybe you guys have heard of a functional medicine provider, but if you haven't, now is your time to learn about it. So Leah, we're just going to dive in because I want people to understand what the difference is here. So tell us a little bit about the difference between a traditional medical approach to health versus a functional medicine approach. What makes functional medicine different and potentially more beneficial for women concerned about their hormones?
Such a great question to start off. Hi, everybody. So happy to be here. So, if you haven't heard of functional medicine before, functional medicine is a different way of approaching healthcare. And it looks at the systems of the body, like your digestive system, your hormones, your heart, your respiratory system, and not just them in isolation, but how they communicate and respond to one another and how they are influenced by the environments that we put ourselves in. Things like stress, lifestyle, how you're eating, your stress, your sleep routines, how all of that influences your physiology on the inside and how it communicates with one another because everything is truly connected. Um, and this is different than the traditional medicine model, which I'm sure more people are familiar with on this chat. But the traditional medicine model looks at the systems of the body in isolation. So if you're having stomach pain, for example, or irregular cycles, they're only going to look at your digestive or your reproductive system on its own. And it focuses more on diseases. So when something manifests into a disease, how to manage the disease and how to treat the symptoms, usually through medication. Where in functional medicine, we try and find the root cause. What is going on in your body that is changing the way that your body works and how we actually treat at that root cause. And sometimes that includes medication, but other times we use different modalities too. We use supplements, sometimes herbal treatments, and lifestyle as a prescription. So exercise, diet, nutrition, stress reduction as a way to heal. So if you're interested in not just having a pill as a solution to a problem, which we're talking about the pill today,
Hmm.
appropriate, functional medicine is a nice adjunctive treatment or a different way of approaching your health that could serve your needs better.
Hmm. Absolutely. So now, since we're talking about birth control, let's talk a little bit about the pill specifically. Many women, some in our group even, are or have current are on currently on birth control or have been for a variety of different reasons. But I think the most common situation they find themselves in is that they're very uneducated on what actually happens to the body when on these hormonal contraceptives. So, can you educate all of us in our little community on how hormonal birth control is designed to work? How does it work?
Sure, that's a really good question and really important to answer and to really understand. I feel like many women have been provided the option of hormonal birth control from a young age,
Hmm.
whether when they first got their periods, maybe it was a little irregular, or they had cramps and horrible PMS, or sometimes acne. It's not always used just for contraception. And when people start it, usually it's like you start taking the pill and you kind of forget about it for many people.
Hmm.
And it's hard to like loop back and understand really what that's doing to your body and how that could be connected to some other symptoms you might be experiencing. So let me try and break this down.
Hmm.
So there are many different types of hormonal birth control, but most of them have either a synthetic estrogen in it or a synthetic progesterone. And those are our two main female sex hormones that regulate our cycle and fluctuate. They should fluctuate throughout our cycle depending upon where we are. But what these hormonal birth controls do is they give you a steady state of those synthetic hormones. And what your body does with that, it's very smart. When you take that pill, you end up developing an excess of estrogen and progesterone because your body's naturally making it and the pill is also giving it to you. So the body actually does something called a negative feedback, where it shuts off your natural production of those hormones because it thinks that you're actually making too much. And that actually happens in your brain. You have a section of your brain called your pituitary gland that secretes two hormones, LH and FSH, that basically make you ovulate every month. Um, and that ovulation, if you don't end up getting pregnant, becomes your menses. So by taking the pill, those synthetic hormones actually shut off your pituitary gland. So you do not ovulate. That's essentially how it works.
Yeah.
It severs that connection between the pituitary and your ovaries. And many women do struggle when they actually come off of birth control for one reason or another, or if they want to conceive, because you need to reestablish that communication, which has been severed sometimes for many years. And it doesn't always pick up right where it left off. Sometimes it needs a little bit of help to reestablish that communication.
Yeah. At one point in my nursing career, I worked in a pregnancy clinic. And it was so interesting because so many women who are on birth control don't realize it's a medication. When you go through the health history and you say, "Are you on any medications?" They're like, "No." "Okay, are you on birth control?" "Oh, yeah, yeah, I am." It's a medication, right? It's not like a vitamin. It definitely is in that medication category. So, with all medications, I think understanding how it works and what the side effects are is obviously what we would consider being an informed user of a medication. So, talking about side effects, can you educate us a little bit on what systems in the body are impacted by synthetic hormones, specifically in this birth control pill?
Yeah, great question. So, some of the main side effects you might have already heard about, there is a slight increased risk for blood clots related to
Mhm.
hormonal birth control. And especially if you're over the age of 35 and you smoke, you're more at risk for blood clots if you're taking specifically an estrogen dominant birth control pill. But some other side effects that might not always be spoken about are these hormone imbalances that we spoke about in the last little section about how the birth control works, because it can create an excess of estrogen and progesterone in your body. It can lead to mood disturbances. I have a study here by JAMA, Journal of American Medical Association, that over 1 million women who began the pill were more likely to be prescribed an antidepressant. So there is an association between birth control and depression and anxiety. There's also issues with energy. So another hormone that is influenced by birth control are our adrenal glands, which secrete our stress hormones, our fight or flight hormones. So when those are altered, you can sometimes get fatigue, tiredness, low libido. Skin issues can also be very common: hair loss, acne, dry, flaky skin, and a lot of vitamin and mineral imbalances. Taking the hormonal birth control actually depletes your body's levels of B vitamins like B12, B6, and magnesium, selenium, and zinc. So if you are taking a birth control pill, making sure you're taking some type of multivitamin or even just a B vitamin, knowing that your body's depleted of those, can help counteract some of those other side effects like fatigue.
Yeah, totally. That kind of goes into my next question specifically is, you know, other obviously with supplementation of vitamins, what else would you recommend to women who want to enhance their overall health, but they're not ready to maybe get off hormonal birth control pill if they're currently on it?
Yeah, such a good question. So I'm here to say, at least this is my own personal belief, that not all hormonal birth control is bad. I'm not here to shame anybody who feels like
Mhm.
it's working well for their body. My job and our job as nurses is to just provide the education and allow the space for you to really understand what the risks and benefits of any treatment are so you can make the best decision for your body. Empowerment, right? Female
Right.
empowerment.
Yeah.
So, there are things that you can do to help with the side effects of the pill if you want to continue taking it. One part I didn't mention of side effects from it are digestive issues. Some people can
Mhm.
get imbalance of their good bacteria in their gut, or something called SIBO in the functional medicine world. It stands for small intestinal bacterial overgrowth. And it's one of the main leading causes of IBS in our country. So abdominal pain, diarrhea, cramping, constipation, um, and ways that you can help to regulate these negative side effects from the pill are trying to maintain a regular detox routine.
Mhm.
So usually I recommend for my patients to do some type of detox every 3 months. And detox is a very big buzzword. There are many
Yeah.
different things you can do for detox.
Mhm.
um, Something as simple as just eating a very clean diet for up to 3 weeks, like
Mhm.
avoiding gluten and dairy, avoiding any complex sugars and alcohol. It just
Mhm.
allows your body to be in a more anti inflammatory state to help heal and repair. Because our bodies are always trying to strive towards healing and repairing itself. So if we
Yep.
can create that little catalyst for it to continue to do its job, usually you don't actually need to do too much. The body will take it from there.
Yeah.
So diet's another great thing. Sometimes I'll have patients do specific detoxes where they take certain supplements that help with the liver to remove any toxins in your system. Because the liver is what helps to package our hormones and help release them from the body when we don't need them anymore.
Mhm.
And hormonal birth control can actually lead to a buildup of different hormones in our liver that are
Mm.
stored in a special way in a hormone called SHBG. So by detoxing your liver, we just release any of those built up hormones to allow those channels to flow more organically.
Mhm. I think just while you're talking, one of the things that strikes me about this functional medicine approach is that it really makes me, if I were the patient, you really have to change your understanding of your health, right? Because there's this proactive approach suddenly where I have to, or I should use put some energy into making some shifts. I think in the traditional medicine model, we're really used to getting a pill to fix something. And that was very apparent when I worked in a hospital. The patient's like, what pill are you going to send me home? I have to fix all my problems. Like, actually, no, there's some lifestyle changes you have to make. So I think what's really cool about the approach that you're talking about, there's a proactive piece of that where you're partnering with the patient, but the patient has to partner with you too, right? To make some of those changes happen. And one of the things you're talking about that this was new to me before we started talking about this topic in general, is gut health. And I think so many women out there, I know a few in the group who do struggle with that. And you kind of start to make those correlations. Again, if we don't see birth control as an actual medication, it's like we take it like a vitamin versus a medication. Sometimes I think that there's a disconnect there of other symptoms we might be feeling. So I think that's really interesting. I just learned something.
You nailed it. Absolutely. And
Yeah.
vitamin has the connotation of that it's doing something good for you, which I mean,
Mhm.
there are some positive effects of the birth control pill, but it's hard for us to not neglect some of the things that aren't so great about it. Um,
Mhm.
to really see it as a medication allows you to see both the good and the bad.
Right, right. So for women who are coming off, I think coming off the birth control pill is kind of a scary time for some people, depending on why they're on it. But also, once you've been educated about what it can possibly do to your cycle, there can be some nervousness about that. So, what would you recommend to those women who are coming off or are interested in coming off, in terms of their overall health from a functional medicine perspective? You kind of mentioned detox a little bit, but is there anything else specifically that you would recommend to those women as they make a transition?
Yeah, absolutely. So planning is the best as you can.
Mhm.
You'll never really know how you're going to feel when you come off of a birth control pill or any medication, for that matter. But trying to have a plan and some support in place with
Mhm.
somebody like you, Sarah, who has
Mhm.
another alternative that can help empower you and teach you about how your body works. Somebody you can check in with and,
Mhm.
share some of your symptoms with can be really vital.
Mhm.
As I mentioned before, making sure you have some good supplements on board that are replacing what the birth control pill is taking away. Usually, a
Mhm.
basic prenatal for anybody of childbearing age for women
Mhm.
will give you the sufficient doses of those B vitamins, those magnesium, zinc that you'll need.
Mhm.
Um, Making sure that you have enough space if you are coming off of birth control because you want to conceive, giving
Mhm.
yourself at least 6 months is ideal because things don't always go back to normal right away.
Mhm.
um, Usually it takes 2 or 3 cycles for your hormones to re-regulate, and
Mhm.
sometimes a little bit longer if um, depending upon the person.
Yeah.
So
And
helping your
I
body along with that is helpful.
yeah, and I've talked to a couple women who get off the birth control pill and things seem okay for a couple months, and then like 6 months later, all of a sudden there's like acne festival all over their face, or they have these symptoms. Can you speak to a little bit to that? Do you deal with patients who are, have that transition time coming off the pill, but then later on they kind of experience these like blow ups of symptoms?
Yes, absolutely. And
Hmm.
especially if you went on the birth control pill for a reason other than just contraception,
Hmm.
because the pill is not fixing that underlying issue. It's not fixing your irregular periods or endometriosis or acne. Like I mentioned, it's just shutting off your ovaries.
Hmm.
So, what happens is when you take that away, sometimes that cycle can restart itself and you're going to get those symptoms again, which is unfortunate. But there are things that you can do to help your body get back into a rhythm.
Hmm. Yeah. Yeah. That's, I think maybe a good education point here is just maybe anticipating that if you went on the pill for a reason, like you said, that, the pill isn't fixing it. So anticipating some of those things coming back can give some people anxiety, but I also think it helps us be more proactive, right? There's things we can do to help get to the underlying causes of maybe why we were on it in the first place,
Yeah.
especially if it's been a long time since you've been off of it, right? And you have to like relearn your body a little bit, and your body has to relearn you.
Yes, that's exactly it. And
Yeah.
symptoms are not always bad. Like we always shame symptoms as something that is uncomfortable, but looking at
Hmm.
symptoms in a different light as messengers, like little detectives for you to help
Hmm.
guide you towards what exactly is going on. So it's
Hmm.
important to not just shut them off, but to listen to them. Like if you're getting horrible PMS before you get your period, or sore breasts, or you're irregular or have pelvic pain, that's telling us something about what's going on inside your body and should be listened to so that we can reverse the root cause of what's going on.
Yeah. I often find too, I teach teens as well as they say, like, I have really bad periods and it puts me in bed, like 2 days out of my cycle. But my mom did too. So it's just, it is what it is. No, 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 no. Like just because your mom might have experienced that or you have women in your family that have similar things doesn't mean there's not a root cause issue that we need to get to. So yeah, I think anticipating that in, like you said, as you are making those transitions and putting yourself in a team atmosphere where you have functional medicine person who's looking at all of these aspects of your life, an educator who can really help you with your body is really important because again, that transition can be a little scary depending on why you're coming off of birth control in the first place. Um, I have a lot of resources I love to share, but I'm curious from a provider standpoint, what resources would you recommend to women in our little community about learning more about the effects of birth control in general? Like, if this has sparked interest for somebody, where would you point them to learn more?
Yeah, so I do have two books that I usually refer to my patients
Hmm.
here to show you. One's called Beyond the Pill by
Hmm.
Jolene Brighton. And she actually talks about and coins the term post birth control syndrome.
Mm.
Um, so it actually is kind of common that women will have flares in like their skin or certain symptoms around
Hmm.
their cycle when they come off of the birth control. And she has a really neat little quiz in here where you can
Yeah.
assess your own symptoms and see which of your hormones might be more out of balance.
Mm.
So I do really like this book and I found it very helpful. The other one I use is called The Hormone Fix by Anna Kabeka. This is
Hmm.
for women who are more perimenopausal or close to menopause who are having some irregularities, not always around birth control, but she does touch upon it here.
Hmm.
Um, and then one last one that is great, and she has a YouTube channel with a ton of resources, is a woman named Alyssa Vitti, and
Hmm.
she has a whole group and community called Flow Living that's
Mm.
all about she has different like herbs supplements that she does, different diet
Hmm.
recommendations to help manage your
Hmm.
cycle and some illnesses around hormones and birth control.
Yeah. And you just said something I think that's important to touch on is a lot of times we're talking about birth control related to women of childbearing age or, kind of like the teens to the 30s or not, maybe early 40s. But those women who have been on hormonal contraceptives for menopause symptoms, right? Or perimenopausal symptoms and whatnot, I think there's a lot of education that can be had there as well. And kind of what you're saying from a functional medicine approach, how do you approach that for that age group of women specifically? Because we've all seen our moms like hanging out in the refrigerator when they're going through menopause or like just like dying of sweat, right? Like that is like the worst. And you're like, I can't believe I have to do that. But does it have to be that bad? That's the question.
Yeah, such a good question. You
Hmm.
know, because I have the command of both the Western and the Eastern approaches, there definitely are certain supplements that you can use herbally that help to ease the transition of your
Hmm.
hormones when you're around menopause. But then there are also bioidentical hormones,
Hmm.
which have a very different risk profile than these synthetic ones that are in birth control. So, bioidentical are genetically modified to look and act just like your natural hormones do.
Hmm.
So you actually can use safely low doses of estrogen and progesterone in the bioidentical form to help with those uncomfortable symptoms of menopause.
Hmm.
And I've had great success with that. Even certain diet treatments too can be really
Hmm.
helpful. One little nugget to help with estrogen detox, which estrogen dominance is very common in women who are
Hmm.
perimenopausal, where their estrogens are fluctuating, but also
Hmm.
women who are coming off of birth control. And cruciferous vegetables, things like broccoli and Brussels sprouts and cauliflower, all help to bind and eliminate estrogen.
Hmm.
So, making sure you have a good amount of those in your diet is just something super simple that can
Hmm.
help with detoxing your hormones.
Yeah. I love all the things you just said because you've approached this from, several different angles. And I know for women in the group who this might be the first time they're hearing about, an organized approach to dealing with something versus like Googling, like, how do I eat differently or which vitamin should I take? There's so much input about making changes to your health to optimize X, Y, and Z in your life, right? But I think what's cool, and I hope listeners are getting out of this, the functional medicine approach, I love that because it takes in all those angles and it organizes it, right, for the patient in a thoughtful way instead of just using one modem, you know, each time to approach the problem. So I think that's really cool. And I hope women are inspired to like at least reach out to you or learn a little bit more about functional medicine because it's really a cool approach to women's healthcare, right? When we've pretty much been given one option our whole lives. So that's kind of
And
stinks.
it's so unique too. The thing that I love about this job, that is just so challenging. I'm sure you can relate to this, Sarah. Like working as a nurse in the hospital for many years, they were just so into protocols. You know, if somebody has X, you give Y. If somebody has sepsis, you give them a liter of fluid and antibiotics.
Mm-hmm.
For me in this role, every person is just so unique that I can have three women who are coming off of birth control and will have drastically different treatment plans depending upon what they preference, what we see in their labs, and
Mm-hmm.
what works best for them in their own lifestyle. And that just
Yeah.
makes it fun because it's never monotonous. It's different every single day for every person.
Yeah. So if people in our that are listening to this video want to learn a little bit more about working with you, how would they go about doing that?
So my website for the practice is emergence.health, where you can learn a bit more about me and about the services I offer functionally. You can also find me on Instagram and Facebook at emergence.health. My Instagram tag, I think, is NP Leah Gagan, which I
Mhm.
guess we'll write my name somewhere
Yeah.
in the.
We'll link a couple things for people so they can find you on that. Yeah.
And I'm
And
happy to
then
if people ask questions,
mhm,
on the thread. I'm happy to answer them as well. I'm sure that,
yeah.
and I hope that this was thought provoking and people have questions.
Yeah, totally. It's funny because I am a fertility educator, and I think as you learn more and more about women's health, you realize how little you actually know, right? Like that pool just gets bigger and bigger and bigger. And this issue is specifically around hormonal birth control is something that I felt pretty naive about until I started doing some reading and whatnot. And I think we just owe it to ourselves to educate ourselves on the medications we're taking or the advice we're being given, even by medical providers and white coats. Like we still have to be critical thinkers about things that affect our health. And so, again, if this was thought provoking for anybody, I hope it was because it was for me. Please engage in conversation about this, especially with us or with your provider. I think it's fair to go in and ask questions if you have any questions about the treatment that you're being given and whatnot. So, Leah, I'm excited because I'm definitely gonna have you on again because your functional medicine approach is super interesting and people need to know more about it. But like I said, I'll be linking some stuff. So if you guys at the end of this video, you find it really exciting, go find Leah on Facebook, Instagram, check out her website. And if that's an approach that speaks to you and maybe you need a health revamp, reach out to Leah. She'll be excited to talk with you a little bit. And Leah, because of COVID, there's some good stuff that's come from COVID, like telehealth options. And so if you wanted to see if her services were available via telehealth, you can contact her and see if that would work. So again, I just thank you so much for being here today, and we will be doing this again. You have an interesting perspective to share.
This was fun. Thanks so much for having me, Sarah.
Thanks, Leah.